This video will show you how to put on a Multipodus or PRAFO splint. These splints are fit by OT to position the ankle in a neutral position to prevent ankle and heel cord tightness. The splint also floats or suspends the heel to prevent excessive pressure to the back of the heel. This splint is also fit by OT for protecting soft tissue such as flaps, grafts, and wound vacs, and protecting healing fractures. Splinting recommendations vary based on the patient's needs. Always refer to the OT splint sheet in the patient's room, OT to nursing splint orders in Epic, or the OT splinting flow sheet in the LDA flow sheet on Epic. These three areas should indicate the wear time, schedule, and any additional recommendations, such as positioning with the kickstand to prevent rotation or chuck liners if drainage is present. Typically, the splint should be removed one time per shift or at least once every 7 to 8 hours to assess skin integrity and ensure optimal splint and ankle positioning. If dressings are present and can only be removed one time per day, the skin should be assessed at that time, but the position of the splint should still be assessed every 7 to 8 hours. Skin areas to assess include the back of the heel, bilaterally on the lateral and medial aspects of the ankle and foot, the sole of the foot, the top of the foot and the top of the ankle, and the back of the calf. Assess for any redness, skin breakdown, bruising, or excessive moisture or maceration. To don the splint, we'll remove the Velcro. We're going to place the pad of the foot against the flat portion or the foot portion of the splint here. And we'll kind of slide the foot down. You may need to apply gentle pressure to the top of the ankle to get the foot in the correct position. Then we will fasten the Velcro on the foot portion, followed by the calf portion. The splints also have a toe piece that allows blankets or sheets to suspend over toes instead of applying direct pressure to the toe tips. And then they also have the derotation bar that can go to either side to prevent the leg from rotating out and changing the position of the foot in the splint. Contact OT to collaborate on changes to the skin in areas the splint comes in contact with. If increased or decreased edema that could affect the splint fit, any changes in range of motion or positioning or activity orders by the doctor, and if pain is reported or signs of discomfort are observed. Also contact OT if a patient is agitated or restless, as people can kick out of these splints and move their legs within the splint, which can cause increased pressure to bony prominences or fragile tissues. And finally, contact the OT if the fit of the splint needs to be assessed because the patient's heel cord is too tight and you aren't able to get that ankle into that neutral position. This can occur if the heel cord itself is tightening or if the patient is experiencing increased tone or spasticity.